Okay, so let's start, guys. Today we are reading about ischemic heart disease. It's of two types: asymptomatic and symptomatic. Asymptomatic is clinically silent, and symptomatic has two types. One's stable angina, and the other one's acute coronary syndrome. Now, coming on to asymptomatic. Well, as you can see here, this is take it as an artery, and this little guy here, his name is cholesterol. So I'm just depicting that to make things easier for you. So if that guy is inside the artery, like if the cholesterol gets in and it's there, but it's not causing significant stoppage to the flow of blood, you'll be asymptomatic even though the cholesterol's there. This type of disease is called clinically silent. The other one's stable angina, in which the guy who goes inside the artery, now there, um, is a bit obese guy. So it will cause some obstruction to blood flow, which will give clinical symptoms. And as we know, with exertion, the patient will get stable angina. There are marked the area which this cholesterol is blocking off compared to the first one, the asymptomatic one. And lastly, acute coronary syndrome. In this, the guy gets so obese that it bursts, and when his tummy bursts, cholesterol is laid off into the system and it clogs up small arteries down the road. Again, it can be of three types: STEMI, non-STEMI, and unstable angina. We'll discuss about them in detail as we move forward. So, let's move on to acute coronary syndrome. When a patient comes in with acute chest pain, acute coronary syndrome symptoms, as you do know, first test, the best test to do is an EKG. Now, the EKG can show two things: either an ST elevation or no ST elevation. There are a bunch of other things which you can also see in an EKG, but let's discuss them later as we get into more detail. So if it's an ST elevation, it's categorized as STEMI. If not, then again we come on to our next test, which is cardiac markers. We do cardiac markers, and if they come out to be positive, it's called NSTEMI, and if not, then that's unstable angina.